Welcome to a training on the Behavior Support Plan content area, Behaviors Targeted for Increase. The learning goals for this training include defining behaviors targeted for increase, becoming familiar with areas addressing this topic in the practice guidelines for behavior support plans and BSPARI elements, learning relevant components of behaviors targeted for increase, identifying examples and non-examples meeting relevant BSPARI elements, and accessing research articles and other resources on this topic. Behaviors targeted for increase should be included in behavior support plans. These could be behaviors alternative to the challenging behavior of concern that are functionally equivalent and/or incompatible. Functionally equivalent means the desired behavior serves the same function as the challenging behavior. Incompatible means the behavior is impossible or very difficult to omit at the same time as a behavior of concern. Other behaviors may be included that are not necessarily functionally equivalent, such as waiting, tolerating delays, following a schedule, to give a few examples. If these behaviors are formally targeted in the behavior plan, they must be included in this content area with an operational definition in a clear form of measurement. Behavior support plans can include behaviors targeted for increase that are adaptive in nature so that persons receiving care can learn to live more independently. Withholding reinforcement is not enough on its own to change behavior if there is no replacement behavior present in the individual's repertoire. Helping the person learn a new skill that is important for and to them is a more person-centered approach to behavioral treatment. Behaviors targeted for increase are selected after the completion of a functional behavioral assessment or FBA. Assessment tools identify behaviors targeted for decrease that the person is omitting, identify motivating operations, setting events, antecedents, and consequences that maintain challenging behavior. The FBA should provide the clinician with a good hypothesis as to why problem behavior is occurring. In some circumstances, behaviors targeted for increase focusing on skill building, such as tolerating delays, denials, and completing tasks to increase independence, may also be targeted in addition to replacement behaviors. The behavior selected should be meaningful to the person, long-lasting, maximize reinforcement, and minimize punishers. The behaviors targeted for increased content area has 4 elements that are evaluated. Information on the elements can be found in the DBHDS DMAS Practice Guidelines for behavior support plans and under the Definitions tab housed in the BSPARI tool. The elements include: lists a behavior or behaviors targeted for increase, an operational definition which needs to be present across all behaviors targeted for increase, a method of measurement across all behaviors targeted for increase, and examples and/or non-examples for at least one behavior targeted for increase. When all elements are present, this content area is in adherence. It is preferred that behaviors targeted for increase have a specific label rather than an all-encompassing omnibus phrase such as replacement behavior, rule following, or safe behavior. A replacement behavior should be functionally equivalent to the behavior targeted for decrease, such as requesting attention, if the behavior has been hypothesized to be maintained by attention. The broader the behavior is, the harder it is to recognize. Operationally defining completing a hygiene routine provides a more specific label rather than completing tasks. Behaviors targeted for increase should be accompanied with an operational definition that is clear, objective, and concise. With an operationally defined behavior, clinicians and supporters can more reliably document and measure the behavior. The behavior can include a dimensional quality that specifies when a behavior occurs and when it ends. Including examples and or non-examples provides the observer with more information to better document the occurrence of a behavior. A goal to increase a targeted replacement or adaptive behavior should be separate from the operational definition. When defining a behavior, it may be helpful to think about whether a stranger would be able to observe and record a behavior of interest based on the definition provided. Each behavior targeted for increase should include a form of measurement. Some examples include, but not limited to, frequency, rate, duration, latency, whole interval, and partial interval recording. When choosing a method of measurement, consider the dimension of the behavior targeted that will help determine meaningful behavior change. Ask the question, what type of measurement would render the most effective results, such as considering the use of frequency, duration, or both? Consider the environment, times when data is to be collected, and the supporters who will be collecting the data. Set up a data collection system that helps a person achieve their goals and is realistic for supporters who are implementing the plan and collecting data. Ultimately, collect data needed to make timely, feasible database decisions. Data for behaviors targeted for increase should be graphed alongside behaviors targeted for decrease. Please see the DBHDS DMAS Practice Guidelines, BSPARI Definition tab, as well as the training provided on the DBHDS website for the graphical displays and analysis content area. Here are some examples and non-examples of elements present in the behaviors targeted for increase content area. Please take a look at the first example, which reads, when the individual is mad, they will communicate that they want the activity to stop 80% of the time. Let's evaluate this behavior targeted increase by taking a look at the BSPARI definitions. Based on the criteria, there is no name for the behavior being targeted. The behavior is not defined objectively, as it includes subjective language, such as the word mad. There is no additional information describing the form or function of the behavior. What does communication look like, and under what conditions? The behavior is written as a goal and doesn't give a clear method of measurement, as the observer does not know what form of data is collected. There are no examples and or non-examples listed, which results in a score of 0 for this content area. Let's take a look at the next example. The behavior has a label, requesting a break, so this element is present. An operational definition is provided that contains the function, the form, or topography, along with information that defines when the behavior ends and when another occurrence begins. There is no information on the method of measurement for what an instance is, and there are no graphs available that delineate a form of measurement. Also, no examples or non-examples were included to help better define the occurrence and non-occurrence of the behavior. 1 point is scored for this content area. For the last example, the behavior targeted for increase has a label, requesting a break. The definition is operationally defined, providing information on form and function, along with criteria on when the behavior ends. A form of measurement, frequency, is provided. There are examples and non-examples present, resulting in the content area being in adherence. Here are some resources that provide further education on elements in this content area. Please note that there are links to this literature in the BSPARI Resources tab. Thank you for taking the time to review this training. Please explore our website for additional training opportunities.